before you even enter the building, there's a reputation that comes with Duke. But I think once you actually enter the facility and the clinic, you find so much more. Everyone had a level of compassion. They also became someone you really relied on during such a difficult time, and that I think is something you probably don't get many other places.
Here at Duke Fertility, we are committed to helping all patients in their family building endeavors. I approach each patient as an individual. At our initial consultation, I like to get my patient's story. Once I have gotten to know my patient a little bit and know a little bit more about what they envision, I'm able to help guide them. And one of the things that I've learned in doing this job is that there's no single way that's the right way to build a family.
The concept is simple, and that is to recreate and protect the embryo just like the human body does. In practice, it's not that easy, and that's where our technology and our years of experience allow us to recreate that as best we can. So we have our state-of-the-art incubators. One couple's embryos are in their own separate chamber. If we have to open that chamber up and take those embryos out to manipulate them in whatever way, it doesn't affect the other couple's embryos. They stay nice and safe and warm where they are.
The privacy and security of patients at Duke Fertility Center is one of the most important things that we offer to our patients. I think that this level of detail and paying this much attention comes down to the fact that we are creating human life. We're in the business of being the best we can be and serving the most patients that we can and creating the most families that we can for people that are struggling.
In the past 10 years as a fertility nurse, it's helpful to know who your resources are, because it does take more than one person to help a patient with everything that they need. Listening to my patients is very important to me because every patient comes with a different story. Every patient comes to us for a different reason, and I think it's important that the patient is heard and that we tailor that patient's specific care to what works for them and for their family.
We are the only fertility center in North Carolina and one of the few in the country to have a clinical psychologist really integrated into the team. Having a place to get support, to be able to talk about what they're experiencing, to be able to learn specific tools for coping with it, not only helps patients to cope better and feel better while they're going through the process, but it also makes it more possible for them to sort of stay in treatment and not drop out before it's had a chance to be successful for them. And so I think it speaks a lot to our awareness of just how stressful and difficult this experience can be, and also to our investment in taking great care of our patients.
There are so many different dynamics and different populations of people's stories that come into the clinic, and I think it just sets us apart in that regard.
I just had to put my trust in my doctor. Luckily, it worked out. And even if it hadn't, I would have felt confident and I would have felt at peace that we did everything we could and that Duke Fertility Clinic did everything they could. It was such a wonderful process that it was sad to say goodbye.